Hello everyone, we are the SGD B10. Now we will present our student project about the retraction. These are our group members. And now my friend will continue with the chapter 1 introduction.
Hello, my name is Felicia with 3 last digit of name 166. I will explain the background and problem formulation of our student project. Eye is an important organ of our visual system. One of the external part of the eye is the eyelid. Eyelid is a movable thin-fold layer of the eye that covers and protects the eye. There are two parts of eyelids, which are the upper and lower eyelids. One of the common conditions that can happen on eyelid is lid retraction, which is a condition that eyelid is retracted either as upward or downward displacement, which then exposes the sclera or the white part of the eye. In this condition, the eyelid doesn't cover the eyeball sufficiently, which is not safe for our eyes. There are many causes of lid retraction, but the most common cause is hyperthyroid conditions called grave disease. Therefore, it is important for us to understand the diagnosis and management for lid retraction to prevent further complication which can worsen our refraction. Next. So in our student project, we are going to talk about the definition, the epidemiology, the etiology, risk factors, classification, ways to diagnose, differential diagnosis, and prevention of lid retraction. Next.
Greetings everyone, I'm Janice. Now I'm going to continue about the objectives of this student project. The first one is to understand the definition of lid retraction. The second one is to discover the epidemiology of lid retraction and to discover the etiology of lid retraction. The fourth one is to explain the risk factor of lid retraction. The fifth one to explain the classification of lid retraction. The sixth one is to understand the diagnosis of lid retraction. The seventh one is to understand the differential diagnosis of lid retraction. And last one is to understand ways to prevent lid retraction. Next, we continue to the benefits of the student project. These student projects bring benefits to medical students where medical students can understand the definition, epidemiology, etiology, risk factors, classification, diagnosis, differential diagnosis, and prevention of lid retraction as a part of their basic knowledge in ophthalmology. As per society, this student project will help people to increase the awareness and knowledge about lid retraction as one of abnormal visual conditions in life. Next will be continued by my friends. Thank you.
Okay, now I will continue the presentation. My name is Mahatma. Last my name are 130. The definition. The lid retraction is a condition when eyelid position is resting in an abnormal high position. This condition made the sclera are visible between the eyelid margin and the corneal nimbus. The lid retraction can lead to lack of thalamus and exposure keratopathy. Most of the lid retraction happen because of the thyroid eye disease, contralateral ptosis, and the recession of the superior rectus muscle. That's from me. Now my friend will give the presentation.
Hello, my name is Angelia Evram Horas with last digit number 055. So I will explain about the epidemiology of upper eyelid retraction. So eyelid retraction most affects a boy in adolescence when compared to girls. This disease often affects adults and is relatively rare in children. According to a study, 1 in 77,000 patients who were less than 19 years of age were known to suffer from eyelid retraction. If we compare upper lid retraction cases were more common than lower lid retraction cases. The cause of patients suffering from eyelid retraction is most often due to thyroid disease as much as 40%, trauma 15%, congenital 10%. Treatment with surgery proof 17 of 62 patients will experience good process up to 94%. Usually 38% of patients with eyelid retraction suffer from irritation and photophobia, and no one complains with secondary visual impairment. Maybe that's it for me. This presentation will continue by my friends. Thank you.
My name is Agung Ragunyat Kanaparawangsa, with student ID number 2025111193, and I will explain about the etiology of eyelid retraction. So the etiology or the most common causes of the eyelid retraction is Graves' disease, which is the thyroid gland when the condition, the thyroid gland is overactive. And ophthalmopathy will occur too if the thyroid gland is unstable condition. And there are other causes that can cause eyelid retraction, which is Cushing syndrome, hydrocephalus, midbrain disease, blepharitis, proposed eyelid surgery, facial paralysis, or trauma that happen or injury that happen to the eyes. Next.
Good morning, my name is Putri Arjuna Satistiawan with last digit student ID number 097. Now I will explain about the risk factor of the upper eyelid retraction. So the risk factor are several. These are the following. First is actinic skin damage. So the actinic skin damage can caused by the cumulative exposure of ultraviolet. Next is atopy. Atopy is mostly related to family history and can also appear when the patient has food or aero allergies. Third is rosacea. So rosacea is a common cause of the skin inflammation, including the common triggers such as sun exposure, emotional stress, hot weather, etc. Fourth is endemic area of trachoma. So endemic area of trachoma is rare in United States, but it's common in several countries such as Africa, Asia, Central and South America. And last is periorbital dermatitis of other cause. Periorbital dermatitis of other cause, it can be psoriasis or contact dermatitis. In psoriasis, periorbital involvement is less common, but it's usually prevalent at eyelid margin. And for the contact dermatitis, it is less commonly a chronic condition. That's all. Thank you. Next.
Okay, hello, my name is Gusti Murariasta Satya Diksa with the digit of my name is 145. Today I will continue about the classification of eyelid retraction. The first, neurogenic. Neurogenic eyelid retraction is a type of eyelid retraction associated with the nervous system, which has quite a variety of causes such as dorsal midbrain syndrome, aberrant degeneration, orbital floor fracture, pinealoma, hydrocephalus, basilar artery disease, encephalitis, bulbar poliomyelitis, epilepsy, oculogeric crisis, palatal myoclonus, seesaw jaw winking, and many more. Okay, that's all about the neurogenic eyelid retraction. Thank you.
Hello everyone, my name is Putri Sameswari with student ID number 2002511202. And now I want to explain about the classification. I'm going to continue with the myogenic one. So myogenic eyelid retraction is the smallest in the classification, including Graves' disease, which is a common cause of the upper eyelid retraction. The cause of the retraction due to the Graves' disease is quite controversial, among others, due to orbital proptosis secondary to enlargement of the rectus muscle, infiltration of the levator muscle, excessive sympathetic nerves, and many other things. That's all about the myogenic. Will be continued by my friend. Thank you.
Hello everyone, my name is Krisana Gramdraja with the student number of 20025111230. So now I'm going to explain about the last classification of eyelid retraction. The last classification is mechanistic eyelid retraction, which has various causes as well, which is mainly related to architectural change in the structure of the eyelids, which is also the main cause of eyelid retraction in Graves' disease. The structural change can occur due to congenital, cicatricial, traumatic, neoplastic, or postoperative.
My name is Indah Krisnadewi and I would like to explain about the diagnosis of lid retraction. To diagnose upper eyelid retraction, clinical measurements can be used to assess for eyelid asymmetry in retraction. Upper eyelid retraction is present when the upper eyelid is displayed superiorly with exposed sclera between the eyelid margin and corneoscleral limbus. The distance from upper eyelid margin to corneal lid reflex or margin reflex distance can be used to assess for elevated upper eyelid position. That's all from me. Thank you.
Hello, my name is Frey Jonathan. With my last 3 name digit number is 164. I'm going to continue the presentation about the treatment. The majority treatment of eyelid retraction is done by surgeries under general anesthesia. There is an alternative treatment to manage upper eyelid retraction in patients who are reluctant and unsuitable for surgery. Botulinum toxin type A or BTA injection is a non-surgical treatment of reversible paralyzing neurotoxin that acts on muscle motor and pads by inhibiting local acetylcholine release. However, this treatment effect is only temporary and has risk of ketosis or diplopia in addition to bruising, edema, and other minor local complications. That's all by me. Next will be continued by my friends. Thank you.
Of the lower eyelid, and the vertical shortage of the anterior lamella on the lateral third of the lower eyelid may cause ectropion, which is the lower eyelid drifts away from the eye and turns outwards. The second differential diagnosis is paranoid syndrome, which is correlated with dorsal midrange lesion, which may cause the bilateral lid retraction due to the loss of supranuclear input to the third nerve nucleus. Patients with paranoid syndrome may present with other symptoms such as diplopia, blurred vision, nausea, and vomiting, which can be asked in the interview. The third differential diagnosis is the orbicularis oculis muscle, which is the sphincter muscles of the eyelid. The weakness of the muscle is a feature of neuromuscular disorder and may result in weakness of eyelid closure and ptosis. Thank you.
My name is Alessandra Putri Windiarto. With my 3 last digit number is 112. Today I'll be presenting regarding the conclusion of the student project. So the lid retraction is a condition that is defined when the eyelid is positioned at an abnormally high resting position. And this condition mostly affects male adolescents with more upper lid eyelid comparing to lower eyelid cases. And the most common etiology of eyelid retraction is Graves' disease. However, other causes such as tumor and Cushing syndrome also play a significant role. There are a few risk factors associated with eyelid retraction, and eyelid retraction itself is classified into 3 types, which are neurogenic, myogenic, and mechanistic. In diagnosing the condition, there are a few clinical measurements, such as the increase of margin reflex distance, or MDR1, and mid-pupil to upper lid margin distance, or MPLD, and the presence of MLPD asymmetries. There are also a few differential diagnoses such as lamellar deficiency, paranoid syndrome, non-thyroid retractor inflammation, and orbicularis weakness. And lastly, the therapy for eyelid retraction includes surgical and also alternative therapies.